Well, Mr. Doherty came to us, actually I'm pretty humbled because he's a executive over in Ireland, and he had asked members of the team that he works with from a peripheral vascular disease standpoint who they would go to have their leg blockage taken care of, and they actually gave him my name. So he came over from Ireland, which is kind of unbelievable, to be seen by us and to be considered for treatment, especially non-surgical treatment for a leg blockage. When he got here, he was a normal-looking executive. I mean, other than his complaints of problems with his leg when he was walking and trying to play golf, he didn't have a lot of symptoms until we started really quizzing him a little closer. Well, Bill came to us primarily with a symptomatic leg blood vessel, and that's really what he came to get fixed. In fact, he told his wife he was just coming over to get that done. But we know the association between what we call peripheral arterial disease, and if you have that, it's up to 40 to 50% of patients that don't have any chest discomfort will have multi-vessel coronary disease. And if you have any kind of symptoms of chest discomfort, you may have an 80% chance of having blockage in the heart. So all patients with peripheral arterial disease really should have their heart assessed, whether it be with a stress test or heart catheterization or something along those lines. So we were kind of concerned from his history that since he had evidence of what we call peripheral arterial disease, which is blockage of the leg blood vessel, that he might have blockage elsewhere. On his examination, we picked up that we could hear the blood flow through his left arm, and that's really unusual. You shouldn't be able to do that. It's kind of like when you put your finger over a hose, that once you kind of block it about 50%, you start to hear a hissing. And that's what I heard in his arm blood vessel, a hissing. And then I was a little concerned again by just a little bit of chest symptoms, and then he had significant leg problems when he walked. So when we saw him, we got some non-invasive studies which did show that he had a significant blockage to the left arm. We found that he did have a tight blockage to his leg, so we decided to take a look at all that and fix as much as possible in just one procedure. When somebody comes to the Center for Critical Limb Care, we're actually treating them in a disease-based state, which is different because you're not seeing just one specialist oftentimes. If you come in with say an ulcer in your foot or just evidence that your arteries are very blocked up, you may be seen by multiple different specialists at that time. Anything from a foot doctor to a plastic surgeon to a blood vessel doctor such as myself or a surgeon. And hopefully we'll have everything looked at, kind of like you don't want to just have your bathroom plumbing checked out. If you have a sink that's backed up, they check out your whole house. So we'll be risk stratifying the patient's other known associated diseases such as heart disease, blockage to the neck blood vessels, risk factors that could be a problem such as high cholesterol or family history. So what we hope that they'll experience, and we really think that they'll experience, is something very unique, which is what we call global vascular care or total body vascular care, so they can really get the benefit of all the different specialists that are available here at Riverside. Here at Riverside, we offer world-class technology in a very comfortable setting. I tell people it's like the best you can get at home. And the question is this: is it worth a drive of 20 minutes, 40 minutes, 2 hours to have you or your loved one get the best care available in the world for your peripheral arterial or coronary disease? I think you bet your life on it.